Hi friends, I just want to talk today about something regarding COVID and the doubts which the common people will get. I'm a doctor. To be specific, I'm an anesthesiologist. So I have worked with many COVID cases and many of them call to ask me regarding few of the doubts, to clarify few doubts related to this COVID and all that. So I thought it would be better if I make a recording and share it with them. So I'd like to share this also with you guys. So coming to the few of the most commonest questions I get on call and everywhere is that the neighbor or the apartment next door has got COVID. They had opened their windows and they were coughing. I had opened my windows. Could I get COVID? And other question is this COVID. Someone was hanging their clothes out to dry, and I happened to be on my terrace and they happened to be on their terrace, and she was coughing. Can I get it? And one more is we were using the same clothes drying place, and the one who had put clothes before me turned out to be positive, and I was using the same lane. So can I get COVID because of that? See friends, I just want you to understand there is something called what I have understood. I want you also to understand. There is something called virus load. Like you have to get exposed to certain amount of virus which is capable of causing infection in your body. See, if you just catch one virus, you will not end up with COVID. Okay, because I have dealt with many cases of COVID who turned out to be positive later after I gave anesthesia to those people. I was not in full PPE when I gave anesthesia to them because they were not positive during that time. So what I have understood, see, COVID is still like maybe, if so, what if, it's like that. Still there are no perfect studies to tell this is what will happen with the COVID case. So according to my experience, I'm telling this. See, when in an open air, like outside, when terrace and all that, even if a positive person is there and if he coughs, it's open space, right? So the virus load will not be that much that it will be there suspended, so that when you go next time on the same terrace, you will catch the virus. There is nothing to prove that you will catch the virus. See, in an open air, when a person coughs in a terrace, they say the virus stays in atmosphere for half an hour to 2 hours. So if you go later, like half an hour later and all that, since it's an open space, the virus load you will be acquiring will be much less to cause an infection. And one more doubt is, my window was open, their house window was also open, they are neighbors, they were coughing. Will I get it? Okay friends, let me make you understand this. Inside a house, when a person is coughing, yes, the virus load inside their house will be much. But once it comes out of the window, see, I'm not telling in a place like Dharvi or somewhere there where the houses will be conjoined. No, I mean, there are there's no place for much space between the houses. Of course, in such places, I can't comment whether you will get or not when the person is coughing. You might get and you might not get. But where the call I get from, they live in a place, well-planned layout, which has minimum distance between houses and windows and all that. And in such scenarios, the load of virus you will be acquiring will be very minimal, and it will not be causing an outright infection. But of course, you guys have to be careful when someone is coughing. You just don't jump into conclusion they are COVID positive, they are coughing, so our windows are also open, I will catch it. No, this is a season where many upper respiratory tract infections can occur, like cough, cold. Not everything is COVID. Because the COVID era is going on, first thing to rule out, what even we doctors do is, first thing we rule out is COVID, because that's in trend. So that doesn't mean whoever has cough and cold and we take the swab, they all turn out to be positive. No, we have patients who have nothing, only headache, and we, as precaution, we do swab for everyone, and when we do swabs for them, they turn out positive. And there'll be few people who don't have any symptoms, but they just come to get tested because they feel that they have been exposed to some sort of things, and when we do swab to them, they turn out positive. So friends, what I'm trying to make you understand is, don't panic. There is something called too much worry. That itself can lead to reduced immunity in your body. panic attacks, reduced immunity. So that is one of the psychological problems the COVID now it's creating. That I can tell with confidence because the one I know, I can't name that person right now. So that person is very close to me, and that person is having like multiple problems like high BP, blood sugar, high sugar levels. She's a diabetic, and she also has hypothyroidism and all that sort of things. And she calls me up every night, every morning when she gets up, or when she before she sleeps. She's having panic attacks, like she's sweating, she can feel her heart rate going up. See, that's because she's watching news of COVID-19, and she hears someone cough in the house, next house, and she gets scared because night times she would have opened her windows to let ventilation happen, and she gets scared and she'll start having panic attacks. She calls me up. I have told her whenever she has such attacks, she can talk out with me. So I have no problem with talking out with her. But since I have seen that, I know many people will be suffering like that. So just don't panic, okay? Think. So what I want to put out there is few points, like open air, like a terrace. The virus load is very much less, and you catching an outright infection is also very less. So just make sure that when you know that the person who was on terrace has turned out positive or something like that, you just make sure that you wash your hands, maintain hygiene. And that's why we are always stressing on that: wash your hands before touching your face. That helps. That really helps. And one more thing I want to tell is about this face masks. What we are using is not 100% protective against coronavirus, because there are some amount of leaks in whichever face mask we are using, like N95 and FFP2 masks. They all have some amount of leak. Not 100% of air we are breathing in through that mask will be filtered. Okay, some amount of leak, like say 0.5% of leak, 2% of leak will be there in whichever masks you are wearing. We just stress on you guys wearing it because the amount of virus load which will be entering with the use of mask is very less, and that is not sufficient enough to trigger an infection in you people. So that's why we stress it. So one more thing I want to say is, just because I'm telling open air infection will be less and all that, and please don't be in an assumption that okay, it's an open air and you not have to think about getting infected. No, it's not only about the open air, it's about the distance between the people you are maintaining and even the mask. See, what I want to stress here is, if two people are out on terrace walking and one person turns out positive, and you were walking with that person for quite some time without mask, you might catch an infection. Not telling 100% you'll catch. You might catch infection, 50%, 40 to 50% chance you might catch it. But if a person is walking on your terrace alone, and then the person goes back and you come up there and walk alone, the chances of you getting the infection is very less. Not telling you won't get infection, telling it's very, very less. So you just make sure that you don't panic when you know that someone like this has come positive. That panic itself can lead to so many other problems that right now the medical unit is not able to address because of this COVID pandemic. So all I'm trying to tell is, stay stress-free life, but never neglect COVID. But don't be worried so much that you will end up in some other problem other than COVID. Since I keep getting calls of all these questions, I thought I would better I would do a recording so that it might help them a little, so they can sleep better at night. That's what this person, whoever gets panic attacks, calls me all the time, so that they can sleep for some time properly. They can have a rest to their bodies once they have rest in their minds. So guys, if you have any queries, just ask it, and don't neglect it, but don't be too worrisome as well. Open air with minimal contact, the load of virus is very much less. And if the patient, and if someone who is hanging clothes or washing utensils, they are using detergents, so the chances of virus staying on that surface is very much less. So you might not be getting the virus load required to cause an infection. So just don't panic once you get to know that some person has come positive like that. You just have to maintain the cleanliness and peace of mind. That's all. That's how we can fight against this pandemic. Yeah, and one more thing I want to tell, and I forgot, is that I got a lot of calls asking regarding this doubt that some person who had turned out positive in their neighborhood has turned out negative now. So once he turned out negative, or he or she turned out negative, they have gone to their place outside Bangalore, and they have come back. So should I avoid them? I might get COVID infection from them? No. See, I want you guys to understand this also, that a person who has turned out positive and again his results shows negative is it is to say that his body has developed antibodies to fight against the virus. So that is called immunity. That immunity stays in the body for quite some time. I don't know how long, but as per I've seen cases who have come with repeated COVID infections, it might stay for around 2 to 3 months. After that, they might get infected again. So during this period when their body has developed antibodies to fight against the virus, if they go out and come, they will not catch the virus. And if you come in contact with them, please be sure that you will not catch the virus, and stop treating them like untouchables, or you can't mingle with them once they have turned positive. Just tell them or let them know that you are okay. He or she has turned out negative. You will mingle with them, but just make sure that once they have turned out negative, they should not think, oh, I'll not get COVID again, and go out without wearing mask or anything. They should follow the same protocol, like wearing mask and all. They can go about their works. But just because he has gone to work and come back, you cannot tell that, okay, I can't mingle with him because though he turned out COVID negative, he's gone outside and come. See, that period of protection against COVID will be there in them for around 2 to 3 months. So what I'm trying to tell is this social stigma, which is happening a lot. I don't know anywhere else abroad, but in India it's happening a lot. Social stigma that once the patient turns positive, you don't want to mingle him anywhere else, he or she anywhere else, because they have turned out positive. Please don't keep that in your mind. Once they've turned out negative, their plasma will have antibodies which can help out other patients if they donate it to overcome the virus. So what I'm trying to tell is, once they turn positive and then negative, they'll have some amount of antibodies in their body. So when they go about their work, it's not that you can't mingle with them. You do mingle with them, but make sure that the person who has turned out negative will not be neglecting anymore by not wearing mask, because he has turned negative. Now his body is fully equipped to fight against virus. So his body will be equipped, but not for a long time. So just don't create a social stigma. Mingle with them. So what I'm telling to you guys is, I know you will be thinking she's telling that also, she's telling this also, she tells mingle, she says don't mingle. What I want to clear out for everyone are 3 main points. First one, if a person is positive and then turns out negative, he will have some amount of protection against the virus for some amount of time. So you can mingle with him or she. You can mingle with them, no problem. But just take with precautions like mask and hand wash. And the second thing is, open air, virus load is less. And the third thing is, just because someone has turned out positive, don't create a stigma against them and stop mingling with them or inviting them for something else, some function and all that. That is not correct, because they would have already turned positive and they would have bared enough with the people around, and they don't want it to continue in their negative time as well. That will impact a lot on their psychology. So these are the 3 things I just wanted to stress, so that people out there who are having doubts regarding this will be helped with my answers for such doubts. Thank you.